Hi everyone, I'm back for my vlog, and this week I'm going to talk to you about breast screening in the UK. So this vlog is only applicable to people in the UK because it's about our breast screening that's available in all of the countries of the UK to every woman. And I thought with the recent controversy we've had about people that have been missed for breast screening, it would be a good idea just to run through what it is, what the benefits and risks are, and what to do if you're one of those women who have been affected. So, as I've said, this is for screening that happens in the UK. 1 in 8 women will get breast cancer during their lifetime, so it's a really common cancer and an important one to find and treat early. And all of the evidence shows us that the earlier we catch it, the better the outcomes and prognosis. The chances of getting breast cancer increase with age. Most experts believe that breast screening is beneficial in catching early breast cancer. If you catch it early, you're less likely to need a mastectomy, that's removal of the breast, or chemotherapy. 1 life is saved for every 200 women screened, so that's 1,300 lives a year saved from breast screening. But having said that, there are some risks, and it is quite controversial about whether or not it actually does save lives. So I'm going to talk about that as well because I think you should have a balanced view. So certainly through breast screening, some women are diagnosed with breast cancer and have treatment for cancer, which obviously is very distressing, that would never have caused them harm and would not have killed them. Estimates say that every 3 in 200 diagnoses via breast screening result in this scenario where unnecessary treatments are given. So that's 4,000 women a year going through that trauma who actually didn't need to. For every 1 woman whose life is saved from breast screening, 3 are diagnosed and treated for a cancer that would never have killed them. So again, lots of harm in terms of overdiagnosis. 1 in 25 women who go for breast screening will be called back for more tests and more investigations. And obviously that's quite distressing and can cause a lot of anxiety and worry. Most of those women will not have cancer. In fact, only 1 in 4, a quarter, will actually have cancer. So there are also false negatives. So some women who go through screening will be given the all clear and be told that they don't have cancer, and in actual fact they have. We think that's about 1 in 2,500 women, and obviously that then allows the cancer to develop, and as we've already seen, early detection is the best detection. And then there are some x-rays involved, and obviously x-rays can be harmful because you're having radiation, although I have to say the degree of x-ray given to you when you're having a mammogram is really tiny and actually smaller than most of the background radiation that we're getting most of the time in life. There are, however, some very respected consultant oncologists and breast surgeons who believe that breast screening does not save lives. There was actually a letter from some very informed consultants in the Times a few weeks ago, and I'll put a link to that so you can have a read at the back of this vlog. I'm also going to put a table at the back of the vlog in the comments below, which actually explains in really simple terms the risks of breast screening or not breast screening, which I thought you could be able to, make your own opinion from. So who gets breast cancer? If it's so common, who gets it? Well, age is the biggest risk factor for breast cancer. So it's more common in women over 50 and in those who have gone through the menopause. In fact, 8 out of 10 diagnoses of breast cancer are in this group. If you've got a family history of ovarian or breast cancer, or you have a definite gene for breast cancer like BRCA1 or BRCA2, and now there is research going into TP53 and CHEK2 genes, those genes put you at a high risk of getting breast cancer. If you've had breast cancer before, you have a high risk of getting it again. If you have very dense breast tissue, this puts you at risk. And exposure to estrogen. So estrogen is one of our female hormones. And so if you started your periods really early and you had a late menopause, it means you've had more estrogen in your lifetime than someone who had late periods and an early menopause. if you didn't have children or you only had one child. So the more children you have, the more protective it is, then you're at risk. Some forms of HRT, but not all. In fact, we know that estrogen alone in women who have had a hysterectomy reduces your chance of breast cancer. So you can find out about those risks in my menopause vlog. Having the combined oral contraceptive pill puts you at slightly higher risk of breast cancer, but the risks with HRT and the pill are tiny. They're actually minuscule. If you're overweight, you have a bigger risk of getting breast cancer than if you're on HRT. If you have high alcohol use, so above the recommended 14 units a week, and if you've had radiation, so lots of x-rays or CT scans for something else in your lifetime, that puts you at high risk. So that's who's getting breast cancer. So to that end, the screening programme in the UK opens to women from the age of 50 because that's when you're most at risk and that's when the screening is deemed to be most beneficial. So all women in the UK between the ages of 50 and 70 will be invited for breast screening. You'll get your first letter inviting you anywhere between your 50th and your 53rd birthday. So don't panic if it doesn't come at 50. Mine came 6 months before, believe it or not, which I found quite insulting. But anyway, I didn't want to be reminded that I was 50. In some areas of the country, you might be invited as early as 47 because there are some trials going on to see if screening is beneficial from 47. Once you get to 70, and this is the crucial point in the controversy that we've just seen, you won't be invited for breast screening anymore. But that doesn't mean that you can't have it. If you want it, you can have it. So between the ages of 50 and 70, breast screening happens every 3 years. You'll be invited every 3 years. Over the age of 70, if you want it, you have to ask for it. So you can do that by contacting your local breast screening unit, and you can just Google that, put your borough and breast screening unit in and you'll find it. Or you can ask your GP to refer you, and either of those is fine. The question is, do you need it over 70? We'll come on to that. So what does it involve when you go along for your mammogram? Well, sometimes you'll have a mammogram and you'll also have an ultrasound, and they'll make that decision on the day, depending on your circumstances, what they find when they examine your breasts, and whether you've got very dense breast tissue or maybe implants. Each breast is examined one at a time for a mammogram, and each breast is placed between two plastic plates that are see-through and squashed slightly. It's not too uncomfortable, but different women find different degrees of pain with this. And then an x-ray is passed through the breast to look at the tissue. If you've got breast implants, whether they're under the muscle or over the muscle, it might be very hard to have a mammogram, in which case an ultrasound or even an MRI might give a better picture. But again, that can be discussed on the day. So that's what the mammogram actually involves. So what happened with this controversy in England? And this, again, only affects England, not Scotland, Wales or Ireland. So up to 450,000 women in England alone, between the ages now of 70 and 79, were not called for their final mammogram. So the last call usually comes somewhere between your 68th and 71st birthday. And those women in the last 10 years did not get that letter or that invite. Now, in order to make reparations for this, all women affected will get a letter by the end of May. And it's being coordinated with GPs. So when you get the letter, you'll be asked to call a special hotline number. And I am going to put that number in the notes afterwards for anybody that's worried. If you don't get a letter by the end of May, you are not affected. So then you can just carry on. And as I said, if you want a mammogram, you can ask for one. If, however, you're not registered with a GP, you do need to call the hotline because there may be no coordination there to get the letter to you in terms of address, etc. So if you're not registered with a GP, please call the hotline. If you don't get a letter by the end of May, you're not affected. But if you're worried, you can call the hotline anyway. And if you want a mammogram, you can have one, even if you're 80. You just need to ask. So then we come back to that question, should you have one if you're 80? So The benefits for screening women over the age of 71 in terms of saving lives and finding cancers that would have actually caused damage are very unclear. And so because of that, that's why the screening stops at the age of 70, because the screening test has to be proven to be beneficial. So over the age of 70, screening could very well find a cancer that does not need to be treated, that would never kill you. You would die before the cancer takes hold and does that damage. So there's a really high chance of overdiagnosis once you're over 70. So I'm going to put a link to a leaflet in the notes afterwards, weighing up the pros and the cons of having breast screening after the age of 70. So I think the really important message here is, firstly, don't panic. Check your breasts yourself regularly. Get to know them so that if something odd comes up, you find a lump or something happens to your nipples that wasn't happening before, the skin changes, the shape changes, you will be best placed to notice it. So the best time to actually check your breasts is probably in the shower or the bath, when you can use soap and your hands are nice and slippery and you can just move them over your breasts easily and notice, as I said, any change in shape, any skin changes, any lumps, anything that just feels unusual. And I'm going to put a link in the notes afterwards to show you the best way to examine your breast, to specifically look for changes and lumps, etc. So I'll do that to give you a guide and then encourage you to do it as often as possible so that you're the best screening service that anyone could possibly have. So I hope that's helped today, and it's just clarified what the screening service in the UK involves, and it involves being called for a mammogram every 3 years from the ages of 50 to 70. Has told you that if over the age of 70 you still want to be screened, you can be, you just have to ask for it, you won't get an invite. I've clarified for you the controversy around those people who were missed recently from their last screening and what to do about it if that was you. So you will get a letter by the end of May if it were you. However, if you haven't got a GP, you're encouraged to call the hotline, and I've put that number in the notes as well. And if you're worried, you can call the hotline because that's what it's for. There is some controversy over whether breast screening actually does save lives. And so to enable you to have a look at that and think about the risks versus the benefits and whether or not it's something you want to do, I've put the letter in the Times from the consultants a week or so ago for you to have a look at, and I've also put a chart showing you the risks and benefits of having screening. So hopefully that's given you a quick overview, put your mind at rest and shown you some tips to actually check your own breast health. So as ever, thank you for watching. Please ask me questions in the comments afterwards. I'll always answer them as I do. And please suggest topics for the future. I've got a few that I've been given for the next few weeks. And as ever, thank you so much for watching and thank you for your support. And I look forward to seeing you next time.